I did a little bit of modification on the original slides that I had here for this part of the cardiovasculatory system. And yes, there is a lot of stuff in here, right? So let's pay attention. Oh yeah, I did bring my insulation. Woo! So we always, encourage people from the back, right? I mean, it's not as much fun if I have to throw it right here in the front, All right, so here we go. Just a couple of clarifications from the last time where we left off here with the blood vessels, right? Remember that we started to mention here about the capillary bed, right? Remember that you are going to have all of the exchange happening at the level of the capillaries, and you have 3 different types of capillaries, right? So here, at the capillary bed, you have the blood coming from the arteries, doing all this exchange. So today we're really going to focus on the exchange part of the stuff, right? And then it gets back here to the veins, and then gets back to the heart. All right, so what is happening here? You have a couple of options, actually, about 3 options or so of how the blood is going to flow and bring the nutrients to your tissues, right? So the first option shown here is that you can come from the arteries through the arterioles. This arteriole right there, you see that is going straight into capillaries. So when you have an arteriole that dumps the blood straight into branching capillaries, you call this thing a terminal arteriole, okay? So this guy here is branching and is a terminal arteriole. So you got 2 names of it. It can either be called branching or it can be called terminal arteriole. Right? So when you see this type of blood distribution, it goes straight into the through capillary bed, and here you don't see the option of having anastomosis. Okay, so the anastomosis is really a different route that the blood can take to either bypass a certain tissue or bring nutrients to a different capillary bed that can be on another side here and this in the same tissue, right? So anastomosis is really important to certain organs that cannot really stay without oxygen and nutrients, like for example your heart and your brain, right? So anastomosis are really common in those organs, okay? So here you see one tissue, one example of anastomosis. And you have different types of anastomosis, but I'm not going to focus on that. Here you're seeing an example in which you have this rerouted blood, rerouted from this side, okay, that goes from the artery straight into the venule and the vein. You call that, arteriovenous, arterio to venous, so arteriovenous type of anastomosis. But you have also different types that goes from artery to artery, or it can go vein to vein. When you have anastomosis like vein to vein, those are really, really very common. And anastomosis that goes like artery to artery are very, very important for the heart, for example. Right? So, because if you have a clogged artery, then your blood can take a different route and you still keep your heart cells alive. Right? Those are not going to regenerate if they die. Okay, the heart cells. Okay. So here just a bit summary on those definitions here. And then remember that you have certain organs that do not have anastomosis because they are supplied by a terminal artery. And here you have examples of the kidneys, because in the kidneys you are going to have filtration of the blood, right? And also the blood that supplies nutrients to the kidney cells, they're coming also from a terminal arteriole. So you have kidneys and a spleen. There's also going to be filtration of stuff in the blood, but not of the blood itself, right? So spleen. and also in the retina at the back of your eyes. Okay, so those three organs do not have this option for side circulation, or they do not have those anastomosis. Okay. And here is an example of this vascular shunt. Okay, the vascular shunt is usually referred to when you have in the middle here of your capillary bed, you have this arteriole that serves also as anastomosis, right? But this arteriole branches out. So for each one of those branches that are going to capillaries, you have those little sphincter muscles that can either be at open or closed state. Okay, so when they contract, they are going to close the flow, and you're going to have less flow to the capillary bed, and more flow just through this type of anastomosis or a shunt that is showing here. Okay. All right. So here's the example of what happens when you contract those little sphincters and what happens to the blood flow. All right, so here we get to the fun stuff. Capillary exchange. It can be a bit scary, but it's actually supposed to be quite simple, right? So I'll try to make it really, really simple. Okay, so let's see what's happening here. Everything is going to happen for, stuff, nutrients and amino acids and sugars and gases. Everything is going to happen at the level of your capillaries, okay? And there are certain ways in which those things can get there. So here are the three ways that those things can get to the tissues. One way is through plain diffusion, simple diffusion. Now, when we are mentioning diffusion here, we really mean diffusion through the cell of your blood vessel. So here is your endothelial cell at the blood vessel, okay? And also through the cells, through the membranes of the cells, like with your red blood cells, okay? So here, simple diffusion. What is governing simple diffusion is going to be just the difference in concentrations. So for simple diffusion, you go from a higher concentration to a lower concentration. So that gradient is going to dictate how much diffusion you're going to have. If you have same concentration on both sides, you're not going to have diffusion. You're not going to have bulk of push, okay? So diffusion, it goes through the membrane, straight into or out of a cell, okay? The only things that are going to go through diffusion, like direct diffusion like this, through the membrane, those are going to be gases. So all of the gases will just go through, and also small non-polar molecules or lipid-like molecules, small lipids, okay? Those are going to pass easily through diffusion, through the membrane. All right, so besides diffusion, you have this other way of getting in and out of places that is called bulk flow, okay? So in the bulk flow, you're going to have a bunch of stuff that is going to go together with water that is going to go through spaces between cells, okay? So clefts or fenestra, or sinuses, right? Those are going to go through the cell, and it's not going to go inside the cell at all. It just squeezes between cells, okay? Bulk flow, simple. That is very important when you're going to have, like for example in the kidneys, you're going to have filtration of the blood and then subsequent reabsorption. So this type of movement is important for those areas, okay? And then you have this third way of going through. This is transcytosis. You have two ways actually of transcytosis. So stuff that has to go through the cell, transitioning through the cell. Transcytosis can happen with little vesicles. Okay, so in this case, the cell membrane is engulfing some particles here, makes a little vesicle. The vesicle goes across and dumps the stuff on the other side. So this is one way of transcytosis. Another way of transcytosis is when you go through some kind of channel, and you can go through this active transport, either primary or secondary. And then this thing gets inside of the cell, gets to the other side of the cell, and goes through another channel that also relies on some type of active transport. Okay, so these are all the ways that we can think of that stuff is going to go through the cell to get to the other side. Okay. All right, so what is showing this side over here? Here you see cells of the tissue that have to get the nutrients and oxygen and stuff, okay? So here is, these here are cells of the tissues. In between the cells and the capillaries, you have this fluid, okay? Fluid between tissue and the capillaries. The fluid here is what we call the interstitial fluid. So between, like inside these spaces, okay? That is interstitial fluid all around those capillaries and bringing things that are going to be taken to the cells of the tissues, all right? So here is your interstitial fluid, and of course here is going to be the blood, right, carrying your all types of cells and things. Okay. All right, so let's see here what is happening with the process of diffusion. Right? So everybody's cool with the types of ways that you can get inside and outside of the cells? Okay, so I'm going to ask you certain questions on, you know, if you have a case like this, what kind of transport is that? So you should know what to answer. Okay. All right, so let's see here with the diffusion, right? What is governing diffusion is going to be the gradient of concentrations. Okay, so you're going to go from a higher concentration to a lower concentration. That's pretty much universal for diffusion, right? So here, that also applies when you talk about the bulk movement of stuff. You're going to go from area where you have more stuff to areas where you have less stuff, okay? All right. So again, what is going to go is straight through the cell. You're going to have gases, and you're going to have small lipids, right? So here are examples of things that will go through: oxygen, carbon dioxide, carbon monoxide too, but that's a poison, right? So not naturally goes. Otherwise, you know, you die. Steroid hormones, those who go through the membranes very, very easily, okay? All right, so basically that is the case for most of the capillaries that you have in the body, except for capillaries that are nourishing the brain, because then for the brain you're going to have an extra layer of protection that is the blood-brain barrier. But we're not going to focus too much on that now. Okay, so really focus on the rest of the body for now. Okay. So what is showing here? Here is showing your extracellular fluid, or it could be your interstitial fluid. And here is showing the cytoplasm of the cell. And of course, here is your membrane. Okay. So here we see at first that you have higher concentration of something. And then this thing goes through diffusion to an area of lower concentration, up to the point that you're going to have equal concentration on both sides. And that takes time. Once you have equal concentration of both sides, then of course diffusion is going to stop. If you don't have a gradient, you don't have diffusion force. Okay. So here we go with this idea of gas exchange, right? You basically have this very passive type of diffusion. So you have oxygen that is going to diffuse from your hemoglobin to areas that have less concentration of oxygen, right? And this will go just when the red blood cell reaches the tissue, and the interstitial fluid has lower concentration of oxygen, that is going to pull the oxygen that is both dissolved in the blood and subsequently the ones that are carried by your hemoglobin. So it gets to the fluid and then it gets to the tissue, and on the other hand, the carbon dioxide also goes through the diffusion from higher concentration to lower concentration. Okay. All right, so everybody knows what is a concentration gradient. Yes? All right. So here is an example of transcytosis. Okay, so transcytosis is going through the cell, and here is showing the example when you form a little vesicle. We call that a pinocytic vesicle, and it's just gulping water with whatever is in it, or liquid, right, whatever is in it. And you mix this little vesicle, we call it alveoli, and it goes from one side to the other side and dump it in the other side. Okay, so examples of things that go through this form of transcytosis, you have here insulin. Remember, insulin is a peptide, right? So it's too big to go through in between the cells through these interstitial spaces, right? And it needs to be transported in a certain way, right? So insulin goes through this type of transport. And another example is also antibodies. Here is saying that when it goes to maternal blood to the fetal circulation, it goes through that pathway. But also antibodies that are destined to go to your mucosal tissue. Okay, like say for example, for the mucosa in your gut, you have certain antibodies like immunoglobulin IgA, right? That will also go through this form of transcytosis. So IgA and IgG, those different types of antibodies, will go through this route of transportation, and then over here it gets to the mucosal side of the intestines. Okay, so two examples that use this type of route. So here's a little movie showing the transcytosis. So here you have something that is being gulped from one side. The membrane makes this little indentation, forms a little vesicle, gets to the other side, joins with the other side of the membrane, and stuff gets dumped. It was a cute little video. No, cancel it. Okay, here we go. All right. Okay, so yeah, I'm going a bit faster because a lot to cover in this class. So the easier concepts, I'm just going to be speeding through. So that's going to be difficult for you to listen to me in the video like a 2x, right? That does not work. Okay. All right, so here, bulk flow is the same idea, you know, of the whole bunch of water with stuff that is in it, goes from one side and gets to the other with a bulk. So you can imagine yourself in a lazy river with your floaty. So the river is your bulk flow, everybody flows together, that's the movement. Okay. All right, so here we are going to start talking about different blood pressures, different areas of pressure. So we know that the arteries are getting the blood from the heart, right? So blood is coming from the heart through the artery. Arteries are going to have higher pressure than the veins, okay? Blood is going to flow from area of higher pressure to area of lower pressure. So when you look at your heart, over here, you have here left ventricle, and you have this high pressure that comes out and goes to the, and then goes to the other arteries, okay? So your highest pressure here, what is it going to be? 120, right? Higher pressure, 120. So that 120 is like right at the aorta, and then you are going to go to the smaller arteries, right? Muscular arteries, distributing arteries, and then you're going to get to smaller, even this is distributing arteries, then you're going to get to the arterioles. So by the time you get here, your pressure is not going to be that high. Okay, so this is when you also start thinking in terms of analogy of what is happening to the pressure and the blood flow, okay, in the big arteries and then get into the smaller arteries. You can start thinking in terms of the aorta is equivalent to I-75. I was going to say 95, but from experience, 75 goes a lot faster. Okay, so I-75 here, you go quite fast. If you have to come out of the highway, let's say also, you have only a few big highways. So we can even say 95 and 75. You have high speed. You have a lot of bulk flow that are going through that, right? Now let's say you're coming out of the highway, you're getting close to your exit. When you reach your exit, you have to slow down, right? So you slow down going through the exit, and then you go to local streets and you go even slower. Now, if you compare the number of exits, you have more exits than you have big highways, right? So you have more exits here and you go slower. And then you branch out to local streets and you have even more local streets and you go even slower on local streets, hopefully. Because if you go really fast on local streets, you're going to hit somebody's house or something else that you're not supposed to go and destroy on the path. Same thing with the blood vessels. If you go really fast and furious through your capillary bed, you're going to destroy blood vessels on the way. Okay, so those very, very delicate blood vessels here, remember, they only have one layer of cells. You only have that endothelium, right? You only have that tunica intima right there. So if you put a lot of pressure there, you're going to damage those blood vessels. Okay, you can have internal bleeding, so that's not good. So here is a lot of bulk and faster, and then here it gets slower, and then even slower. And by the time you get here to your venous side, you have a much slower pressure than you had when you entered the capillary bed. So the pressure is going down, but it's not zero. Where is it that you're going to have pressure zero or very close to zero? Chocolate. Yeah, everybody heard that? No? Inferior and superior vena cava. When you go back to, where is that going? Remember your right atrium right there? Raw. That's where you're going to have blood pressure that is close to zero, okay? Because the blood, in order for it to keep on flowing, it still has to go from area of higher pressure to area of lower pressure. And when it gets here, that is zero, it's going to drop here in the right atrium. It just drops there, and then it loses pressure, and then what do you have to do? All right, people in the back, I do want to use this link shot. What do you have to do? What happens when the blood totally loses the pressure up there? It's a simple question. Everybody awake? What is the job of the heart? Pump the blood. Yay! You got, okay, I'll give you. Here. I gotta use this thing. It's actually a lot of fun. You should try it. Ready? Okay. Yes, girl. No, you don't want it? You want it? Okay, ready? Oh, that's a challenge. Wait. Okay, watch your eyes. Woo! Almost there. Okay, the angle was a bit off. I should get the fancy ones with the angles. Laser. Okay, that's true. All right. So it gets there, it loses the pressure. So you gotta build up the pressure again. That's why the heart has to pump. If it doesn't pump, you totally lose the pressure. You stop the blood flow and you die. Simple. Yes, we're dying. Okay, here. So pressure is going to change, right? And here comes your first question. All right. Let's see what's going on here. All right. What is the primary mechanism by which oxygen and carbon dioxide exchange occurs in your capillaries? So you don't need a lot of time for that. Okay, so here the fun starts. All right. How is this stuff going to be exchanged in your capillaries? This is when you start talking about fluid exchange and those scary things, the Starling forces. So let's try not to make it too scary, right? So what is going to happen here? You have two types of forces. They are going to either favor the flow or oppose the flow. Okay, simple stuff. Either you go with the flow or you go against the flow. Okay? So these two forces are hydrostatic and osmotic. So here let's just keep in mind that analogy with the lazy pool. Okay? If you are on a fast flowing lazy pool and you're pretty much like by yourself on your little float, you are just gonna go and float and basically you're gonna go quickly to the other side wherever you want to go. Okay? If you are in that lazy pool, but okay, so the force that is carrying you around is the water force. That's your hydrostatic force. Okay? If you're in the lazy pool and you're not by yourself, but you have 100 other people together with you in the pool, you're not going to move so quickly, right? You know, like how Disney water parks get during the middle of the summer, and you're trying to get a spot in the lazy pool, and everybody's just stuck there and barely moving. That's your osmotic force. Too much stuff in that pool, even if you have some water trying to move you around, too much stuff in there, is going to serve as an impediment for you to get to where you're supposed to go. Okay? So just keep that in the back of your mind, because now we're going to see how we place them and how they are either favoring you to come out of the pool or opposing you coming from the pool, coming out of the pool. Okay, so those two forces, either the water moving you force or the bunch of stuff in the water, those are the Starling forces. Okay, now what is going to happen here? When you have your blood vessel, so let's draw here your artery. This is your capillary, okay? The arterial side of a capillary. When you are here, little thing in the blood, okay, and you want to come out of the blood and go to the interstitial fluid, this movement is called filtration. So out of the blood, into the fluid, into the interstitial fluid, and then go into the tissues. This is your filtration right there. When the stuff is in the fluid and needs to come back into the blood, so that's going to be at the venous side, so the blue. Then this process here is the process of reabsorption, right there. So filtration, you come out of the blood. Reabsorption, you go back into the blood. Everybody cool with that? Yes? Yeah, I'm going to ask a question about that too. Okay. All right, so let's see what is happening here. What is favoring filtration? You have the blood pressure. So here, in the beginning here of your capillary, you have that blood pressure that is coming from your arteries, right? Capillary is also artery here, okay? And that blood pressure is not going to be as high as you had when the blood just came out of the heart, right? So up there it was like 120. But then remember, the aorta has that elastic movement and is going to push the blood, you keep it circulating, and then you get to your muscular arteries, and then you start branching out. So when you start branching out and going to the smaller arteries, your blood pressure is going to start to decrease because you're distributing that blood through all these other vessels that are branching out the main vessel. By the time you get to your capillaries, your blood pressure is going to be about 35 millimeters of mercury in average. Okay, so this compared to 120, it's a huge drop in that pressure, but it's still enough pressure. Okay, so you get here, you get to your blood, you get to your capillaries, and you have this hydrostatic or this blood pressure that is around 35 millimeter of mercury or so. All right, so that pressure is going to be a force that is going to push stuff towards filtration. Okay, what else is going to help here? If you look at the stuff that is in the interstitial fluid, like proteins or solutes that are here in the interstitial fluid, okay, you're going to have solutes here that are going to help to pull water from the blood. Okay, so the presence of solutes here is a driving force for pulling water out of the blood. So that is also going to favor filtration. Okay? So this osmotic pressure here, this stuff here creates osmotic pressure that's going to pull water out of the blood. So everybody's cool with that, right? Okay. Any questions about that? No. Two forces, right? So the amount of stuff, of solutes here, that can pull water out of the blood, it all amounts to a little bit of pressure, like 1 millimeter of mercury. Okay? So that's going to help to pull water out. And then this pressure here, which is about 35 millimeters of mercury, is also going to help to push stuff out. All right. Now we're going to see stuff that promotes reabsorption. Okay? You also have some fluid pressure. Okay, so you're going to have some fluid, interstitial fluid pressure. But here, look, the interstitial fluid pressure taken from a person who is healthy, this interstitial fluid pressure is basically negligible. It's close to zero. So most of the time you can just ignore this interstitial fluid pressure that is going to push stuff back in because it's very, very low. Okay? And then you have your blood osmotic pressure, or it's called also oncotic pressure. So here is going to be the concentration of solutes that are in the blood. Okay, so here you have all sorts of proteins and salts and things that are dissolved in the blood that make this thing a pulling force for osmosis. Okay, so this concentration of oncotic pressure is going to pull water, like pulling from osmosis, attract water to the area of less concentration of water. Water is also going through that gradient pull. You have more water here, less water there. The solutes here are pulling the water from more concentrated to less concentrated water. Okay? So these are the forces that are going to favor bringing back stuff from your interstitial fluid. Okay? Everybody got that? Yeah. Now, when is it that you're going to get this interstitial fluid hydrostatic pressure, water stuff in the tissues? There's not going to be zero. You are going to get this number to be higher than zero when you have problems. like when your heart's not pumping well, or when you have atherosclerosis, or basically you can have edema. Okay, so swollen limbs, especially legs, that's a sign of edema. And then this number here is higher than 0. Okay. All right. So this is from your book, showing how those forces can be looked at. So you have here your hydrostatic pressure, and you have here your osmotic or oncotic pressure, and I just explained that. So I'm going to fly through that. Okay, so now comes the fun stuff. Okay, so what is going to happen over here? Those forces are going to dictate whether you have filtration or whether you have reabsorption. In order to figure that out, you're going to have to plug numbers in and see that if you have a positive value that comes out of those numbers plugged in, then filtration is happening. If you have a negative value, then reabsorption is happening. So that's easy, right? Now the question is, what are those values? So let's say, just like we said before, okay? What you're gonna see here is what is favoring filtration. We said is going to be your pressure, your blood pressure here at the beginning of your capillary, and is going to be the osmotic pool. So see the arrows? These two arrows are going to favor filtration. Okay? So here we are going to say favoring filtration. That's the blood pressure. That is the osmotic pool. What is going against the filtration is going to be your osmotic pool from the blood. Okay, osmotic pool from the blood. And is going to be your, what is it here? Your hydrostatic push from interstitial fluid. Okay, so that is going on the other side. These two are going this way, the other two are going the other way. So you're going to take that out, looking here at your arterial side of your capillary. Okay, so let's see what is happening here. Your blood pressure at the arterial side is 35, and the pull from interstitial fluid is 1. So these are favorable. You go 35 plus 1. What is opposing is the oncotic pressure from the blood, so that's 26. And this interstitial fluid that is also over here because the same everywhere. This interstitial fluid, okay, pressure is same everywhere. So this is opposing over here. So at this side here, you have, that equation. You calculate the equation and you come up with a number that is 10 millimeters of mercury. The number is positive. That means you have overall filtration. That cool? Yeah? Yeah. All right, so now let's see what happens here at the venous side. So this is getting to the venule. In the middle, nothing is happening because the forces cancel out each other. So that's where you have this purple area here. Now let's look at the bluish area. Okay, so what is happening over here? Net filtration is the blood pressure at this side. The blood pressure here is lower than the blood pressure there because the stuff came out, the hydrostatic pressure was lost. So the pressure here is 16, your blood pressure, right? So you go 16, the blood pressure, plus 1 that is this factor over there, same thing as over here, okay? Minus your oncotic pool and your interstitial fluid push. You get those numbers, calculate, and you get negative 9 millimeters of mercury. Negative number means you are getting reabsorption. Is that simple enough? Yeah, so if you have different blood pressures, you should be able to put those numbers in and figure out if you have filtration or absorption. And that's a great test question, right? Don't tell me I didn't tell you. I'm telling you. Okay. All right. So here is your Starling equation, right? So the fluid, the net fluid, if it is positive, it's filtration. If it is negative, is reabsorption. We are going to forget about those constants because that makes the stuff more complicated, and I don't like complicated. Okay, so this is exactly what we had said before. You have hydrostatic pressure that favors filtration. You have interstitial pressure that opposes filtration. Then you're going to have capillary oncotic pressure that opposes filtration. You have interstitial oncotic pressure that favors filtration. Remember, negative times negative gives you a positive. Simple algebra. And you thought you never needed algebra. Okay. So if you put numbers in, you should be able to figure out if you have filtration or absorption. So here is an example of what is happening, right? So let's say here, if you have a certain value of capillary hydrostatic pressure that is a bit higher than your 35. So this guy is 37, a bit of higher pressure, okay? And you have here your interstitial hydrostatic pressure that is usually 1, okay? Now let's say here that you have an oncotic pressure that is about 50. That means, ooh, you have a lot of solutes in the blood. You have a big pool for the water, right? And you're going to have your oncotic pressure that is nearly 0. Can you solve that equation? Yes? Hopefully? Yes? If you have trouble solving this equation, talk to me. I mean, honestly. Okay. So you come up with a number that is negative 14. What is happening here? What's going on here? Is it absorption or is it filtration? Absorption. Okay, which one you want? Nuts or no nuts? No nuts. Oh, good catch. All right. You have absorption, right? Negative goes in is absorption. All right. Everybody got that, right? So here. Not all the fluid is going to be reabsorbed at the venous side. So we have here a lot of filtration, and then you're not going to get all the fluid that goes back in. Some of the fluid is going to be around there in the interstitial space, and is not going to be sitting there forever. That fluid that stays around here is going to be absorbed by capillary action of your lymphatics. Okay, lymphatic capillary. That's going to pull the fluid in, and then it's going to dump it into the vena cava, and it's going to be back in the circulation. Okay, it's going to work like little straws. They're going to suck up the fluids that stay around there. Okay, about 85% of the fluids get back in the blood, and the other 15% get reabsorbed by your lymphatics. Okay? Okay. So this is from a nice visual from osmosis, okay, showing here that you have your arterial side and your venules on this side here, okay. So here you're going to have in the middle your mid-arteriole, they're right there in the middle, okay. And you have your arterioles that have the muscles, and then goes to the capillaries that do not have the muscles, right? And here you have your forces. Either it favors filtration or it favors reabsorption. Okay. So this is also from the book, showing the little picture. Okay. So here's a clinical correlation. Okay. So let's say here you have a patient that has abnormally high blood pressure and is usually in that state. So a constant high blood pressure. Actually, high blood pressure, we call it the silent killer, because you don't have symptoms of high blood pressure. By the time you have a symptom, it's really bad, like a stroke. Okay, so high blood pressure. So what is going to happen here? When you have constantly high blood pressure, you are, oh, the numbers, no numbers here. Okay, so you are going to end up with this part of the equation that goes very much high. So you're going to end up with a lot of filtration and not a lot of reabsorption. And this is why you have a lot of fluids that accumulate in tissues, especially in lower legs. Okay, so when you see a person with swollen limbs, swollen feet and legs, you can do a little, pressure, like a pinning type of pressure on the person's foot or leg, and see that if you have this indentation, this pinning indentation, as soon as you let go of the pressure, this is a sign of edema. Okay, and after a while, then the fluid redistributes, and you get the swollen foot. But that's really edema sign. And it's also common with pregnancy, especially third trimester of pregnancy. You get swollen legs and feet, and you do that, and you see that, yeah, that's pinning edema. So it's a sign of too much filtration, not a lot of reabsorption. Okay. All right, so with that, we'll finish up on that session. Do we have questions about that, filtration absorption? No, everybody cool? All right, so now we're going to go into this other area here that talks about the flow, more about the pressure, but this, yeah, pressure in the vessels, and also resistance. Okay, so this is from the study videos. Yeah. Oh, by the way, let me tell you, I'm going to take it verbatim, and I'm going to put it on the test. Okay. All right, so let's see what's happening here. The video is showing here example of flow of blood. So the flow of blood has to do with how quickly those red blood cells are going through those vessels. Okay, so if they're just walking, it's like, hey, we need to speed up. Let's push it from 5 milliliters per minute to 20 milliliters per minute. So we're like running faster. So that's the flow. Okay. Now, blood pressure is how much pressure that blood is exerting on the walls of the vessel. And we are really talking here about arteries, because at the venous side, the blood pressure is not really that important. Okay, it's going to be lower. So we're just talking about arteries here. Okay. And when you talk about resistance, that has to do with what is trying to stop the flow of the blood. So we're going to have two things that are mainly going to oppose the flow of blood. One of them is going to be how big the blood vessel is. So if the diameter of the vessel is large, then the blood can go through it easily. Right? If you squish the blood vessel, then you put a lot of resistance, and these poor guys are trying, they'll have to crawl instead of walk in order to go through that blood vessel. So diameter of the blood vessel is indication. Lower diameter is more resistance. The other factor is how thick the blood is. If you have more stuff that makes the blood thick, then it's harder for you to swim through it. Okay. All right. So here, concerning the blood flow. So you're going to measure it usually in milliliters per minute. Okay, at rest here, and let me see here. Factors here that are going to affect your blood flow. Of course, the first one is going to be your blood pressure, because if you don't have the pressure, you're not going to have flow. Remember, the flow is going to happen going from higher pressure to lower pressure. That's the rule. Okay. Another thing is going to be the resistance. If you have a lot of resistance, you're going to have less flow. Okay. Another factor, yes, is the venous return. So the amount of blood, or meaning the volume of blood that is circulating. Okay. And of course the velocity, and then velocity is also related to the pressure, right? But that always, those factors are really influencing the flow. All right. So here looking at the blood pressure, okay? When we talk about blood pressure, we're talking about arteries, okay? And we're talking usually about systemic arterial blood pressure. We're not going to really talk about lungs or pulmonary blood pressure. That's a different story for pressures, okay? But when you talk about blood pressure, it's usually systemic. Okay. Remember that in order for the blood to flow, you're going to have a difference in the pressure. So the gradient of pressure is going to dictate how well the blood will flow, okay? How is it that you're going to get a good gradient? Well, it has to do with how much your heart is being put out. It is helping to push the blood. It's going to have to do with how much blood you have to be pushed around. And it's going to have to do with how much resistance to the flow that you're going to have, okay? So let's see here. How is it that you can get a good flow and a good pressure gradient? Okay, so let's just have an idea here of what is happening from your heart. So here you're going to have your aorta, and then you're going to have your muscular arteries and venues, and then here you're going to have your capillary bed. So what is the blood pressure at the capillary bed? Capillary bed at the arterial side, average, low, what's the number? We just looked at it. 35. 35. Who said 35? Okay, you got one. Ready? Okay. Whee! Yay! Okay. 35 millimeters of mercury. What is your blood pressure right after the aorta, after systole? 120. What is your gradient here? How do you calculate a gradient? The difference is the drop. Is 120 minus 35. What is your gradient? I'll believe you. 85. That's a big gradient. Okay. Now, let's say that instead of having the nice big gradient that's going to give you a lot of flow, right? Let's say now that you have somebody that has atherosclerosis. Atherosclerosis means a lot of resistance to that blood flow because the arteries are not very much elastic, and that is going to oppose the flow. It's going to really oppose the flow. So the pressure is always higher here, and by the time you get to your arteries, to your capillaries, let's say that you have now a blood pressure here that is around 50 millimeters of mercury, okay, at the arterioles. By the time you get to the capillaries, it's going to be even less. But now let's see here, 50. So what is your gradient here? Is what? Is 70. So you have less gradient there than you had it in the first place. Less gradient is going to give you less overall flow, okay? If by the time you get to your capillaries, this gradient is dropped a lot, that you don't have enough pressure for filtration, that is going to send a signal to your heart that it has to pump harder. So a lot of resistance from your arteries is going to tell your heart, pump harder. So the heart is going to start to work harder in order to pump more blood, to have enough blood for filtration at your capillaries, and that is strain on your heart. Okay, so arteriosclerosis is going to get your heart quite upset. Okay, you have to work harder. All right. So looking at the resistance. Okay, so opposing the flow. Okay, and is based on three things. Three things that are very, very important to oppose the blood flow. One of them is going to be how viscous the blood is, so the viscosity. Another thing is going to be how long your blood vessels are. And the third and most important factor is how wide is the diameter of the blood vessel. Why is that the most important factor? Any guess? Because you have basically no control to change the other two factors. So if you want to control your blood pressure and blood flow, the only thing you can control here, the body can control here, is really the diameter of the blood vessel. Okay, so let's see what's happening here. But these are the three factors that can influence as resistance factors. Okay, so let's see here. First thing you're looking at is viscosity of the blood. That means how thick the blood is. Okay, if you increase the thickness of the blood, you are going to increase the resistance of the blood. How can you get the blood to be thicker? Well, if you are dehydrated, I got thirsty just thinking about that. If you are dehydrated, your blood is going to be thicker because your hematocrit count is going to go up. If you do blood doping, the blood is going to be thicker. Okay? If you are producing a lot of blood cells, that's your polycythemia, your blood is going to get thicker, right? Usually those factors do not really change much if you're healthy and you're drinking enough amount of water, right? You usually keep that constant at a certain level. All right. Second thing, so here's the thickness, right? Thickness of the blood. The more stuff you have in the blood, the harder it is for the blood to flow. So if you compare maple syrup with orange juice that is not as thick, this one will flow a lot easier than the syrup. Okay, so the idea here is that the viscosity that is represented as this here, this term here, the more viscous the fluid, the more resistance you're going to have. Okay, that's simple, intuitive. Okay. So here also showing the comparison with too many blood cells. Okay, if you have a lot of blood cells, you're going to increase the viscosity. That increases the resistance. If you don't have enough blood cells, you're not going to have a lot of viscosity. That means you're going to have less resistance in the blood. Well, you're going to be in a bad shape because of the anemia itself, but at least your blood will flow easier. Okay. All right. Usually that is kept constant the same way that the blood vessel length is kept constant. But what is the idea here of the length and resistance? The longer the vessel, the more the resistance. Okay? So if you have very long blood vessels, you're going to have to push it harder for the blood to flow. Okay, when is this important in terms of humans? Well, when you have a little human, the blood of the little human is going to have less resistance to flow than when you compare with a full-grown adult. So children have less resistance based on length of blood vessel as when you compare it to adult. Then you have other situations that you have more resistance to flow in cases of changes in body size, like for example with morbidly obese patients. Because when your tissue, when your fat tissue, and your whole tissue is really increasing a lot, your blood vessels undergo angiogenesis, meaning you have to make more blood vessels to nourish all that tissue, meaning your overall blood vessels are going to have more length. And that is overall going to put more resistance to your blood flow. Okay? So length of the blood vessel. All right. So here's the idea that the longer the blood vessel, the more resistance that you're going to have. Okay. So here's the most important factor, is the diameter of the blood vessel. Okay. The most important factor that is going to influence blood resistance. This is when constricting the blood vessel or dilating the blood vessel comes into play. Okay? When you constrict the blood vessel, you are going to increase the resistance. When you dilate the blood vessel, you're going to decrease the resistance. Think about those red blood cells trying to run through that vessel. Okay? Now, the influence in the diameter is very dramatic. Look at this. It says the resistance is inversely proportional to the diameter. Not only it is inversely proportional, but it's to the fourth power. What does that mean? That means resistance. Let's translate that, right? Resistance is proportional to the inverse, so 1 over the vessel radius. So let's put here radius. This is resistance, okay? But to the fourth power. You know what that is? Can you plug in numbers in this formula and figure out how much resistance you have? I hope so. Okay, so let's see what it means here. Look, if you double some radius, so here let's put 2 times the radius, how much is the resistance going to increase? So 2 to the power 4 is 16, okay? That means your resistance is going to what? Doubling the radio is going to have, you're going to have 1 over 16. Your resistance is going to go down a lot if you double the radius. Okay? If you do half of the radius, then you're going to increase your resistance by 16 times. So changing that radius is going to have a huge influence on the overall systemic resistance. Okay, we're going to have better examples of that. Okay, so here, this is also from osmosis. Okay, so here, look, resistance inversely proportional to radius to the fourth power. Okay. All right. So here are just some visuals on examples of how length of the blood vessel influences resistance, right? So they have this nice analogy saying that if you are going to drink a milkshake that is quite viscous, would you prefer to have a wide straw, or would you prefer a wide and short straw, or would you prefer a skinny long straw? Well, if you actually want to drink the milkshake, you go for the wide and short straw, right? Otherwise, you're going to fight a lot for this milkshake to, get to you. Okay. So that's what's happening with the idea of resistance in the arteries. All right. So here, a bit more on the blood flow. Okay. So your blood flow is very much proportional to the drop in pressure. So here comes your pressure gradient that we just mentioned before, right? If you don't have a good pressure gradient, you're not going to have a good blood flow, okay? But then it is inversely proportional to the resistance. The more resistance you have, the less blood flow you're going to have. So how you put that into an equation? Blood flow is proportional to the pressure drop, but inversely proportional to the resistance, okay? That's pretty much intuitive and it's pretty much easy to follow, right? All right. So here, just putting into terms of what is happening in your whole system. Remember, your highest blood pressure is going to be found here in the aorta, right? And then it goes down and down and down. By the time the blood reaches your right atrium, it's going to be 0, okay? And that's what really keeps your flow going. because you're going to have always this gradient, because by the time you get to your heart is 0, then the heart is going to pump it again, and you're going to have the gradient again. Okay. Now, if you look at the difference in the blood pressure from the aorta all the way to the capillaries, you're going to have this much of a gradient. But the drop in the gradient is not going to be the same throughout the length of those vessels. You're going to have initial drop and then a bit more drop. By the time you get to the arterioles, you're going to have the highest drop in that gradient. Okay? So the arterioles are going to give you the highest drop in the gradient. Look at this. You are going from a gradient that is pulsating, right? That's the heart going from 80 to 120, 80, 120. This is happening. Where is that happening? At the aorta. Okay, so your larger arteries here, your distributing arteries are also going to have that pulsating type of blood pressure, right? Can you feel the pulsating aspect of your distributing arteries? Yes. What am I asking? Can you feel a pulse? Yes, unless you're not alive. If you're alive, you should be able to feel pulse. Where do you feel the pulse? Pulse, right? Or you can feel it here, right? You have other places that you can also feel the pulse. I have a picture for that, right? But you feel it. When you feel it, you go like, oh, boom, boom, boom. Oh, the higher part is here, the lower part is there. Look at this distributing artery. It's going also 80, 120, 80, 120. Oh, that's good, that's good. By the time you get to the arterioles, just before the capillaries, look at the drop. And it goes from pulsating to laminar, smooth flow. By the time you get to the veins, you're not going to feel a pulse. So when you are feeling here the pulse, you're feeling the pulse that's coming from your arteries, not from the vein. The veins have laminar and very low pressure. So you're going to feel the arteries, okay? And the biggest drop here from pulsating to laminar is going to happen here at the arteriole. Look at the drop, big, big drop. So it makes sense for the blood to control the diameter of those arterioles, because that is going to govern the distribution of the blood and the flow of the blood in general. And this is why you have all those sphincters in the arterioles. They're going to control blood flow, and you also have the thickest tunica media in the arterioles that are going to contract and cause vasoconstriction, or they can dilate and still, cause vasodilation and less resistance to the flow. Okay, so here, looking at the whole picture of your arterial functions, so we know that elasticity is a very important thing for aorta and distributing arteries, like muscular arteries, and the elasticity is what gives that transforms that potential energy into kinetic energy, back into kinetic energy to keep the blood flowing. Elasticity has a different name. You can call it compliance. Okay, so compliance of the arteries. So you can imagine when you have atherosclerosis, you have very low compliance. Arteries are not very elastic. Okay. Another name for it, or another description, is how distensive the thing can go. Distensibility. Okay. All right. So another thing is important, of course, for the blood pressure is going to be the amount of blood that you have, right? So remember that in some arteries you're going to have pulsating type of pressure, but by the time you get to the end of your arterioles, that thing is going to be laminar. Okay, the pulsating aspect is going to disappear. And that is important because, I just talked about that, that is important because by the time you get to the capillaries, you don't want to have pulsating stuff over there. That's going to break your capillaries, okay? So you want to have laminar flow of the capillaries. All right, so here is that picture of how and where you can feel your pulsating. Here, you have your carotid artery, you have facial artery, temporal arteries, brachial artery, radial artery, femoral artery, although that's not very quite often used to feel the pulse. You'll be quite an uncomfortable thing if you go to the doctor and say, let me feel your pulse. Hey, okay, here, okay? All right, so behind your knee, you can also feel pulsating, right? And also at the feet. All right. I find this very interesting. Okay. All right, so things that you should know. Okay, you should know about your mean arterial pressure, and we did talk about that before, right? Here you're going to find in more details how you calculate your mean arterial pressure, okay? That has to do with an average between your highest pressure and your lowest pressure at the pulsating arteries. So higher pressure is 120, lower pressure is 80. But here, your mean pressure is not really the average of 120 and 80. It has some other numbers stuck to this. And you're like, what, does this make sense? Is it supposed to make sense? Well, yes. Because remember how your heart is working. Remember the whole we will rock you type of thing, right? So the first thumb, and then the second thumb is the heart valves, right? And then the part is diastole, filling up the heart. If you calculate the timing that the heart spends in systole comparing to the time it spends in diastole, you see here the diastole time is longer than the systolic time, okay? You spend about three times longer in diastole than you spend in systole. So here, your systolic pressure, your pulse pressure actually, is going to be calculated as 1/3 of that pulse pressure plus your diastolic pressure. That's going to give your mean arterial pressure. Okay, so you're going to spend a long time in diastole, 1/3 of the time in systole. You're going to get your mean pressure here, and the total mean arterial pressure can be calculated like that. In average, your mean arterial pressure is going to be around 93 millimeters of mercury. Okay. All right, so let me see what else I need to cover here. Okay, all right, so this just to reiterate what is happening at your capillaries. Blood gets there more or less at 35. It gets out of there more or less at 16 millimeter of mercury. You want to have low pressure there, otherwise you can burst those capillaries. Okay, so here, if you have a situation in which you increase your blood pressure a lot, then you're going to have more fluids that are going through filtration, right? Okay. Oh, another question before you leave. Here we go, just in time. Here we go. Predict the change in peripheral resistance as the blood vessel diameter is increased. So what do you predict? Okay. You get your points just before you run out. I'm going to stop here. Okay, what is your prediction? Do you need more time? Yes, all right. Do have, technically speaking, 2 minutes. Up a little longer, just so you can get your points and change your mind and get the correct points. So you have 3 people that are telling me B.
Are they these?
I'm sorry?
Like for the study videos? Mm-hmm. Is it this, like the dynamic study module?
Go to your textbook.
Okay.
The text. Okay, down, more down. Here.
Okay.
And now here, go to learn. Right? Now you go down the chapters. Suppose this first chapter is always open and I don't know why. Go down. Where's the rest?
don't know. Oh, by chapters. That's the thing by exam. Okay.
Yeah, so find all the chapters there.
All right, and then just watch all of these videos.
Watch the ones that you find more helpful.
Okay, thank you.
You said to ask you where the videos were if you don't know where they were.
There, you found it? Did you see it?
I did not see it.
Okay, so, if you need to know about the videos, I'll do it in my computer so everybody can see it at once. Okay, so it's staying around, yes. Okay, let me put here the vote for A, okay. Close this, yes, I have a question.
I was just wondering if you had like any advice regarding like different positions to get some like hands-on medical experience. Could I come to office hours to like pick your brain about that? Would that be okay? Is that
Actually,
something
I
you
don't
know
really have an idea,
Okay.
because I'm not like clinician or involved.
Okay. Wasn't sure if you have any ideas.
No ideas.
Okay. Okay.
But you can ask around, maybe his daughter
Okay.
or in the department.
Okay. Perfect.
Or those guys that were here before, you know?
Okay, yes.
Yeah, I
Okay.
think they have better idea.
Also, I'm so sorry. So for my exam, it got like marked as a 0 on the Scantron. It got fixed and everything.
Oh, okay.
Was that, did I fill something out wrong or was it just
No,
misplaced?
no, in your case, the Scantron facility, whoever was scanning, they messed up a lot of people.
Okay, that's what I figured because
Yeah.
I thought I got that right.
No,
Okay.
everything was correct, it's just that, yeah, they messed up a bunch of people. It was not only me.
Grade's good then.
If you
Like,
got
it's
your
like-
grade now,
Yeah, because mine was also a 0.
oh,
Said
then it changed.
Yeah, said I
Okay.
either didn't do it or I filled out my name wrong, but I double checked everything before I turned it in.
No, they messed it up.
So
And they
everything's
have
good.
people- yeah.
Like everyone's test is there. So
Yeah, yeah. If you got your score, then it was fixed. And we get
Okay.
like other professors, they had like 50 people who didn't get scored at all. So yeah, I had only about 10.
Okay.
Well, thank you so much. I'm sorry.
No problem.
Have a good night.
Yeah.
I just want to know about the piercing videos,
Okay.
like how to find them.
And you also?
I have one question.
Okay.
So I was a little confused on the osmotic pressure in the blood vessels because I didn't understand how it could flow both ways. I know one is only 1 meters of mercury, but shouldn't it just be the gradient difference overall of solutes that control the flow of water? You know what I mean?
Yeah, that takes a little bit of digesting what is in there. Okay, so you have to think about two terms. One is the pressure due to water. The other one is pressure due to stuff that is in the water. Okay,
Right.
So,
the osmotic,
yeah,
just the stuff that's
the
in the
osmotic,
water.
right.
If there's solutes on both ends,
How much solute is in both ends? You have more solute in the blood than you have in interstitial fluid. Okay, so the amount of solute of the interstitial fluid usually is not going to affect anything. So we usually just ignore that.
I thought that was the one that was
Yeah,
hydrostatic
1 or
would
0,
do.
close to 0. Yeah,
Yeah, I understand.
Yeah, it's-
that,
yeah.
that makes sense to me that it would be like much less.
it's low, it's near,
I guess
yeah.
the thing I'm confused is why it's any at all. If the solute concentration is higher, you know what I mean?
It is, you do have some solutes there. It's not going to be just pure water because the interstitial fluid is bathing the cells. If you have just water there, then you're going to have swelling of your cells because water is going to be pushed to inside of the cells.
Oh, okay. it's
So you
because
do
of
have
the
solutes.
cells. Yeah, I understand that
Yeah.
there are solutes. I just thought it was like the net difference that it would only flow in one direction because of.
Basically, that's the case. And then what you have to focus on, because you look at the solutes in the blood, it doesn't really change. 26 here, 26 there doesn't change. The solutes up there, they don't really change. What is really going to change is the hydrostatic pressure. That is really going to tell you if you're going to have filtration or reabsorption.
Yeah.
So when you have too much high pressure, you have high pressure here, high filtration, but then at the side of the venous side, you also have high pressure. You're not going to have good absorption. That's a problem.
Yeah.
Okay? That's when you get liquid accumulation.
Yeah. Understood. Thank you.
Oh, you have to sign. Okay, so let me unplug it there and use the computer here. And I'll show you the thing. You also have to show that. Okay. This here. Let's make sure I come out.